Welcome back. Joining us live now, Dr. Isaac Bogoch, Infectious Diseases Specialist at Toronto General Hospital. We're always happy to see you, Dr. Bogoch. This morning, we want to talk about whooping cough, and it gets that name because of the sound it makes, but also because if you get it, it whoops you. It really does. I had it when I was 9 years old, coupled with asthma. Not fun. But Ontario's cases of this could reach the highest level in a decade. So here's the question. How do you know if you or a vulnerable family member has whooping cough, and what action should you take if you suspect that it is?
Yeah, great question, Jennifer. Thanks for bringing that up. And yeah, of course, we know that we're seeing a big resurgence of cases in the province. It's not just an Ontario issue. This is a Canada-wide issue. And in fact, it's even bigger than that. We're seeing this elsewhere in the world, including the resurgence of other vaccine-preventable illnesses like measles. It's a huge problem. Things to look out for are severity of cough, especially in the youngest of the young, and prolonged cough lasting, over 2 weeks. And if people are having a severe cough or a prolonged cough, it's always a good idea to chat with a healthcare provider. Conversations like this are important. Many people might not have heard of this infection, and ensuring that the general public and, of course, healthcare providers are aware that this is circulating with a greater frequency now can enable people to seek care, help facilitate clinicians doing the diagnostic test for this. But the key issue is prevention, right? This is a vaccine preventable illness. The vaccine is given at 2 months, 4 months, 6 months, 18 months, before 4 to 6 years of age, at 4 to 6 years of age before kids enter school, in teenagehood, in adulthood, during pregnancy. So the key here is prevention and ensuring people are up to date on their vaccines as well.
Okay, good messaging there, and a reminder for people to get vaccinated against it. Also, Dr. Bogoch, staying with respiratory things, the province's rollout of the expanded RSV vaccines is getting closer, coming up in October. What should people watching know about it?
So this vaccine was approved by Health Canada, and now we're starting to see it roll out in various provinces. In Ontario, it's going to be covered for people over the age of 60 who either live in long-term care facilities or other congregate settings, or people who have certain underlying medical conditions that put them at greater risk for severe RSV infection. For example, people on dialysis, people with organ transplants, people with stem cell transplants, Indigenous communities, and a few other people. That's who it's covered for. There's other people where it's not covered in Ontario just yet who might be interested in this vaccine. Again, have a chat with a healthcare provider. The National Advisory Committee on Immunizations suggests that people over the age of 75, especially those with risk factors for severe disease, that they get this vaccine. And people over the age of 60 who are not covered by any provincial program who are interested in this vaccine are at least eligible for it. Some may choose to get it, some may choose not to get it, but currently they'll have to pay out of pocket for it if it's not yet covered.
Okay. Dr. Bogoch, moving on to Mpox, nearly 30,000 suspected Mpox cases have been reported in Africa so far this year. That appears to have doubled the total from all of 2023. Fortunately, number of deaths hasn't doubled. So what do you make of that when you hear those numbers?
This is awful. And, this isn't new per se. We've known that this epidemic in Africa, especially in the Democratic Republic of Congo, but now spilling over into other neighboring countries, has been brewing for a while. It's taken years, plural, years, for the international community to essentially band together and organize the facilitation of vaccination programs in the Democratic Republic of Congo. The DRC has ample ability to vaccinate. They do a wonderful job with, for example, their public health outreach for emergencies like Ebola. They just didn't have access to the vaccine. I think the tragedy here is that it's taken several years to enable vaccines to be available in the Democratic Republic of Congo. And yes, there's logistical hurdles. Yes, there's regulatory hurdles, but 2 years, give me a break. Anyways, they're starting to trickle in now. They'll be able to mount at least a meaningful response now. Better late than never, but we surely can do better than waiting 2 years for these to roll out in the place that's the hardest hit.
Yeah, no, absolutely. And, you want to get this under control because, these viruses, these diseases know no borders, and we could be looking at more cases here. All right, important conversations. Dr. Isaac Bogoch, always appreciate your time. Have a great week ahead, and we'll chat with you again soon. Take care.